Thank you very much for the introduction, Kat. My name is Hans Ossebaard, and I want to make you compliments to the organization for organizing this first virtual meeting. I visited before physically, and I'm sure all of you share the feelings of a kind of loss that we cannot meet in person. But let's do it in the digital way, and we will speak about sustainable healthcare quality, one of the greatest global health opportunities at the moment, is my opinion, and not only my opinion. Okay, sustainability. When we speak about sustainability, we usually understand the financial and economical sustainability of the healthcare system. We speak about the affordability of care for society, for persons, for households. We also fill it in like organizability of care, of the robustness of the system in the future. But today, I would like to speak with you about sustainability in terms of green care. Green care and sustainability. What does it mean, this combination? I remember my father speaking in the 70s, worried about the results of a report called Limits to Growth by the Club of Rome. Maybe some of you remember it also. You know, the Brundtland Report, the Kyoto Protocol, An Inconvenient Truth, the movie, the Paris Agreements in 2016. These were all about climate change and the effects on society. And the response, the policy response of society was to try to install sustainability in all parts of society. And sustainability means something like keeping the resources for our next generation there. It is a response to some serious trends. And in terms of healthcare, we usually speak about the future accessibility. Can we guarantee it in the way we do it now? Future quality, cost, resources, and also solidarity, because sustainability is about a kind of intergenerational solidarity. Okay, we all know about what I call the mantra of this time. I'm sure many sessions and many colleagues were speaking and sharing thoughts on what to do with rising expenditures, what to do with the changing demography in our countries, what to do with infectious diseases like COVID. They all stress our system. But there's another urgency actually that belongs to this zeitgeist mantra, and I call it sustainability. It puts another stress on the system, and it challenges our creative and intellectual and maybe also financial capabilities. It is necessary to think about that because, as you all know, there has been a lot of social unrest last year, especially 2019, before COVID. Social unrest about fears and anxieties of what climate change does to the Earth, to the planet, to our mobility, to our energy, our safety, our food, all big transitions. But you seldom heard a lot about what it does to health and what healthcare does to climate change. This has to do something with sustainability. Climate change, yeah. I'm sure I don't have to explain the workings of climate change to you, but this is a NASA picture picturing over the last 1,000 years the carbon dioxide emission. As you know, carbon dioxide is produced by human activities, by burning fossil, by oil and other fossil substances. The Earth warms because it cannot dissect its warmth to the outer world. Okay, we had many responses. International level, the Green Deal, over €1 billion will be spent to the energy transition. And it has also its effect on healthcare. I was affected about 5 years ago by the publications of the Lancet Countdown project. This is a huge independent scientific project of over 24 academic institutions around the world of all continents. A lot of disciplines were involved: scientists, ecologists, economists, psychologists, engineers, doctors, and they all reached a kind of sad conclusion. Their conclusion was that over the last 25 years, we haven't reached a lot in curbing the effects of climate change on health, which would mean that the benefits, the health benefits that we gained over the last 50 years would all be lost if we wouldn't do anything. So this is important, to realize the effects on health. And what's more important, the effects come earlier and faster to us than we thought before. The key messages of this Lancet Countdown project were that first, that the early warning systems of the effects of global warming were already there. We could see them in the prevalence and incidence of new diseases, of emerging diseases, of re-emerging diseases. The second message, based on the results of the ongoing results of the Lancet Countdown project, is that the lack of progress in reducing the emission was threatening our systems, our democratic systems, our societal systems, and our lives across the world. Their third message was that there's only one thing that can really change this global warming. Because it is an effect of human activity, we are the only ones who could change it, to define the health of future nations, in fact. And to do that, a widespread understanding of climate change as a #1 public health issue is crucial. That inspired me some 5 years ago, professionally, both professionally and personally. And I was actually wondering that, this greatest health opportunity, as scientists call, was not picked up by so many colleagues of mine in the medical world. And actually, we were only focusing on the threat. It is also a threat, absolutely. This is a threatening picture where one can see the causal pathways of climate change with regard to health. If you want to look at more closely, you can always go to the website here on the right side. But you see, at the upper side, you see the greenhouse gas emission causing climate change and global warming trickling down, mostly in very intricate, indirect ways, to the incidence of all kinds of health-related effects, and the nutrition, anxiety, and panic disorders belong to the mental health. You see cardiovascular disease attributed to effects of climate change, for example, by heat waves. And one has these urban heat islands where older people or children or people with chronic diseases are affected. The effects of drought and fire all over the world, both in the rich countries and in the lower income countries. And we see all kinds of diseases being strengthened by climate change. Of course, on the right side, we see kind of social intermediating factors. Mass migration because of, in Polynesia, some islands are disappearing. People have to move. Violent conflict. The conflict in Syria has been interpreted as an effect of climate change and water control. And underneath this picture is a lot of research from the Countdown group, and also from other sources have expressed this fact. It's not a matter of fake news, so to say, because climate change has been subject and is still subject of enormous disinformation campaigns, mostly by the vested interests of the industry. We can't close our eyes for that, I'm afraid. And independent organizations like the European academies have confirmed the same results in a different way. WHO is one of the international organizations that promotes awareness for climate change. And yeah, also scientists. I think a few journalists started with it. They said, yeah, climate change is not the right word. Isn't it more urgent? And people in science, we speak about health emergency. Climate change is a health emergency. A climate emergency. And for instance, COVID-19, discussed on the conference, of course, in many ways, can also be seen as an expression of climate change. All right, now we have established the effects on health of climate change, indirectly and directly. We should also turn our look inside a little and look at healthcare. The healthcare in the Netherlands is the second biggest industry in terms of money and people. And it contributes considerably to climate change. And this causes practical problems, but also moral problems. Since our oath of Hippocrates says to us, well, do not harm in the first place. And it feels a kind of strange that at the front door we cure people, or we try to cure people, or prevent people from being ill. And in the back door we throw out medicines, and we cause a lot of emission, and we cause a lot of waste. Health and healthcare have not been very high on the international climate agenda, which was more about energy, food, mobility. But now this is gradually changing because of these publications. Yeah, not only in my country, which is about on the left side, but in many, many countries worldwide, it is calculated that the healthcare emissions contribute to about 5, 6, 7% of total emissions of countries. The high income countries on the left belong to the top emitters. The lower income countries on the right, we don't even know it. But what we know, they suffer most from the consequences. So there's a feature of inequality and development attached to climate change. Another picture, here is my country. It's about 6%. It is calculated by Healthcare Without Harm. And it's, well, it's just comparable with many other countries, 6, 7%. In the Netherlands, we have been analyzing this, and we found that about 80% of the footprint of healthcare is divided between the energy use of buildings, hospitals, for instance, travel movements of both healthcare workers, professionals, and patients, and a somewhat smaller part, the life cycle of pharmaceuticals. So these are three components, together about 80% of the carbon footprint, which lend themselves for action. Also the other ones, of course, food and ICT and water and sanitary, but these really matter. If we can change, for instance, the carbon dioxide emission connected to hospital buildings, or if we can lower the emission of car use, reduce the pollution by medicine, we can really make progress in reducing the ecological footprint. Okay, this is a global finding. Healthcare is a major contributor to climate change. This article is recently published by Lancet. And yeah. Can you now we have established this, can you provide us with a poll for which we see the results at the end?
So hopefully my colleague Emily is going to be setting up the first poll. Here we go. So please answer the poll now.
Okay, I'm not able to see it. But now we have established the effects of climate change on health and the contribution of healthcare to climate change. Do you think there is such a thing as a practical and moral responsibility to reduce the footprint for healthcare professionals?
I think most people have answered that one, Hans.
I have looked into the program of our conference this week, and I couldn't find the word green. I couldn't find the word sustainability in a green sense. So it's not very evident that we think it's a responsibility of healthcare professionals. Has it been finished, Kat?
Yes, I think pretty much everyone has responded.
Okay.
Would you like the results, Hans?
Not yet.
At the end. Okay. At
the end, yeah. Okay, what can we do in the face of climate change and its effects on health and healthcare? Well, it depends on the level of responsibility that we act, of course. And there are international organizations like the WHO, UN, climate change panels, NGOs, professional healthcare organizations like IHI or ISQA, the International Federation of Medical Student Associations. They all can press and can raise awareness for this #1 public health issue. Of course, our national governments, they issue measures with regard to adaptation and mitigation, not only in health, but also in health. Industries and insurers have their role in healthcare, as well as healthcare professional providers and patient consumers organizations. Of course, university, academic world. And this raises another question. What should we do as IHI members, host of today's international conference? Do we have a special responsibility to promote sustainability as a dimension of healthcare quality? Usually we speak about healthcare quality in terms of effectiveness, cost effectiveness or efficacy, satisfaction, equity, accessibility. Maybe the impact on the environment could also be construed as a dimension of healthcare quality. What do you think about that? Should we promote research and thinking about this? Okay, good.
Yeah, I think most people.
I can't see you guys, but yeah, I guess you've probably filled it out.
That's right.
And we'll see the result at the end. Many measures we have taken in healthcare are already in place or are being put in place. And there are many possibilities. Many mitigation and adaptation measures can be taken to reduce energy, to reduce greenhouse gas emissions, for instance, in anesthesiology, and reduce pollution. Providing care closer to home, digital solutions, also in the wake of COVID-19, significantly reduce travel movements of both professionals and patients. Vehicle emissions, well, you can read it for yourself. An interesting one is the green IT story. There's a lot of e-waste, of course, and use of information technology causes quite a lot of pollution. The cloud begins with coal, somebody said, you know, and most data centers are not yet eco data centers. On the ground level, sustainable procurement of products, of course, and of food, medical devices can play an important role to greenify our healthcare system. Okay, at the end of the day, also in the wake of COVID-19, many people speak of a reset, not only of our society, but also of our healthcare system. But it's not just our healthcare system, of course. Sustainability has to do with our health, and for instance, prevention. And investing in health and prevention would make an incredible difference. And I hear many voices discussing this, also to rebalance the health and the social care system, and to decentralize innovations. I view healthcare sustainability in terms of green care as a way to innovate, a way to improve healthcare, and therefore changing the rules of the system are necessary. We've been speaking this on the first day of the conference, and it would perfectly fit into this new idea to reset the healthcare system, to advance sustainable healthcare for the benefit of patients and for society. Of course, these digital solutions, are showing the way with respect to this. And the idea is that the economic and health benefits will totally justify sustainable care. Many people are fearing that they have to give up what they do, that the costs are enormous, that we lose jobs because of sustainable healthcare. But what I see in terms of evidence from all kinds of disciplines, the economic and health benefits of this type of innovation, greenifying healthcare, are quite incredible. And this is not just a framing. Okay, I think we coming to the end by showing you a great example of Frances Mortimer from England. She and her group at the Sustainable Healthcare Center developed a new value in terms of quality care for our healthcare system, a value that includes environmental metrics. So we're not anymore talking about the money, the social side, when we try to calculate health benefits for the population, for individuals, but we also include environmental metrics. So that sustainability, as it's pictured here, becomes a dimension of healthcare quality. Check this name, and if you want to speak with me about that, you can connect with me through this email address. And now I turn back to Kat to receive some questions.
Thank you so much, Hans. That was
to see the results of the two polls.
Absolutely. If you want to stop your screen share. Fantastic. Thank you so much. So the poll results were overwhelmingly answered yes to your questions. 93% roughly of respondents said yes, we do have a moral imperative to reduce the carbon footprint of healthcare, and 93% said yes, organisations such as IHI and BMJ, who co-host this conference, have a responsibility to promote sustainability. So I think quite clear answers there. We've had quite a few questions in the box. Some of these I think you've addressed already in your talk about the estimated percentage of carbon footprint to healthcare, which were in your slides, which will be available to people afterwards. Yeah. One question is, which you've touched on a bit about the reset, but you might want to talk a little more about, do you think the pandemic will assist global climate change in a positive way and therefore improve global health?
I couldn't understand the last part. Okay.
Do you think that the COVID pandemic will actually have a positive effect on climate change and therefore global health?
Yeah, that's part and parcel of many discussions at the moment in healthcare. And I mean, optimistic as we try to be, we will see this, this crisis. I mean, crisis in Greek means choice. So we can make new choices and reset the systems, because this attack on the healthcare system also revealed, I think Donald Berwick has been speaking about it too, the weaknesses of our system, and we need a new kind of resilience, which is supposed to be found in prevention, and not only in a healthcare system that produces also illness. And that's what we don't want morally and practically. And this is really the chance also for digital solutions to break through. I mean, it's not, digital solutions were never been meant to fully substitute human interaction. I mean, we're all sorry that we can't be there in Copenhagen at this moment. But blended forms of care, where digital solutions are combined with in-person care, are the future, of course. And as a as a great epiphenomenon, this contributes to reduced ecological footprint. And so there are many good examples, good practices, but they have to be many of them have to be researched, because they're still pilots or best practices. And at the end of the day, they have to be embedded in guidelines and standards. And also, let me make a plea for scientific research that not only includes effectiveness or patient satisfaction or efficacy, but also green methods. What does this intervention contribute, to the environment?
Thank you. And that's been a discussion and during the talk around, how much carbon emission have we reduced by having this conference digitally and virtually. And also someone's pointed out the unseen cost of digital transactions, which you mentioned, the cloud starts with coal. So there's a lot of discussion of these things. Someone has asked, which I think is a lot of health systems are struggling with, in terms of single-use healthcare items, cannulas, syringes, things like that, how do we find the balance between sustainability and sterility, and knowing that's been exacerbated with COVID?
Yeah, in the Netherlands, just a few weeks ago, the cutting disciplines, as we call it in medicine, I think 16 professional organizations in total joined with regarding to a concept called the green ER, the green ER. And many people, many younger specialists, they were actually shocked by the culture of waste in emergency rooms. Even with a small surgical operation, you end up with about eight huge bags of plastic, many disposables, and we think it's safer or cheaper or better, but they collected evidence, and they wanted to change this for good, and produce less waste. And it's hard to say, to speak about that in general. But there are, the implementation methods to get this working. It's also a question of attitude, and because we need to change the culture of waste, not only in healthcare, by the way, but in society at large. And we need people to think about it and to find creative, smart solutions, which at the end of the day will cost less.
I think we have a lot to learn from resource poor countries as well. I mean, if you go to emergency department in Ghana, for example, where I've done some work, it is not wasteful. Every cotton ball, every set of gloves, are really precious. So I think there's a lot of
it's true. it's true. In the beginning of the lecture, I was speaking about the top emitters are the high income countries, and people who are who are at the front of of the effects, who will be affected by the effects of climate change, are mostly people in low income countries with fragile healthcare systems, or healthcare systems in crisis or war. And well, that's a fact. And in terms of crisis or war, first things first, of course, and safety of patients and staff comes first. That's clear.
Thank you.
On the other hand, there are analyses that low-income countries can also leapfrog to the future, and thereby avoiding wasteful solutions that were made in the old world, so to say. They can adopt new thinking and new models of organization immediately without making the old mistakes.
They can learn from our mistakes. Hans, we only have 3 minutes left, unfortunately, but I think we have time for one last question, which is, what do you think is the biggest challenge to include a discussion of climate in healthcare decision making between professionals and patients, so on the microsystem level?
Yeah, good question. Thank you. The issue is about health, not of you as my patient or of me as a doctor, but of people outside us in society, or maybe even people that have not already been born. So it's a question of solidarity. And of course, if you're very ill, or if you're wounded or in acute care, this is something that cannot be discussed. But I think the way to discuss it is via the guidelines, via medical guidelines and standards. When this is done well, the construction of these standards and guidelines, patients are involved in that, as well as insurers, and they all have a say, and they all should be more aware that environmental impact, does matter, and is increasingly viewed, with all the evidence I've shown, as a central health issue. And which cannot be avoided. It may be hard to think about it. It's maybe new, or it requires changes in our mind and in our behavior and in the culture of our hospital, for instance. But we have to tackle it. It's no way we can escape it, and we won't escape, of course, the benefits of tackling it. It's not just we're all going to die because of climate change. It's also about the challenge of the new solutions, the new green solutions for health and for money, really, because it will deliver benefits in that sense.
Well, thank you so much, Hans. And that's a really lovely note to end on, reiterating the global health opportunity that we have at this time. So thank you so much. I'm sorry we couldn't have longer. I feel like we could have talked about this for hours, and there was an excellent discussion going on in the chat. Hans has put his email on his slides, so do reach out to him later, and the slides will be circulated for attendees. So thank you very much, and we'll close the session there.
Okay. Bye, everybody. Thank you for listening.
Bye. Thank you.
Stay healthy. Bye.